It's very dire. We're not seeing this anywhere else in the country.
Women deserve choices, and we have very few now in Darwin.
If we wanted another one, we're not going to do it up here. It's too much risk.
Sophia Scaturcio's pregnancy journey wasn't straightforward, going through multiple rounds of IVF and a threatened miscarriage before giving birth to her daughter at Darwin Private Hospital last year.
I felt safe because I had continuity of care. I had the same obstetrician. Every time I went, she knew who I was, what we needed to do.
She wants to grow her family, but won't be giving birth in the Northern Territory again.
I don't trust the hospital to manage my care with best practice women-centred care.
Sophia is among a growing number of women travelling interstate to give birth or leaving the Territory altogether after Healthscope abruptly closed the NT's only private hospital maternity ward. The decision has forced the NT's last private obstetrician to close her practice.
I'm worried about the Northern Territory. We have very complex healthcare needs.
The closure of the private hospital's maternity ward has added around 300 births a year to Darwin's already stretched public hospital, and doctors say the consequences are already unfolding.
We've seen mothers who have been delayed in the care that they've received. They've been labouring in places that are not maternity spaces, areas such as waiting rooms. There's a lot of burnout in the workforce, and there's a lot of frustration from our obstetricians and midwives.
The NT government responded to Healthscope's departure by turning this Darwin Airport hotel into a substitute maternity ward for postnatal care. It also awarded a $1.1 million contract to midwife Claire Marks to establish a private midwifery practice. For Dr. Alia Vamuri, who grew up in Darwin, staying is no longer an option.
Because of essentially a lack of infrastructure and a belief that the women who I care for deserve a certain standard of care.
The NT government's health department says it's still finalising a funding proposal to the Commonwealth for $10 million to upgrade infrastructure at the Royal Darwin Hospital. But it's unclear how much of that will go to maternity services. The government says it has sufficient delivery rooms and obstetricians to cope with demand, but the Australian Medical Association says the NT government has been too slow to act.
We should not be the jurisdiction that has the claim to fame of being the only capital city, the only state or territory that doesn't have private maternity, because that is the start of the collapse of the healthcare system.
And he says there is a solution. He says the NT government could take over the private maternity ward sitting dormant next door. Roxanne Fitzgerald, ABC News.